In this video, we'll talk about real life skin monsters, specifically parasites of the skin. We'll take a look at some of those creepy crawlers that can affect the skin, how to avoid them, and what can be done about it once you get them. Before we get started, don't forget to hit the like and subscribe button, and don't forget to hit the notification bell to get notices of future episodes. So let's talk about scabies. Scabies is actually a very common skin infestation. The infestation is caused by microscopic mites, tiny little animals that are microscopic, meaning they're too small for you to see with the naked eye, that burrow or dig underneath the skin and eat dead skin cells. And that's how they nourish themselves. They multiply on skin. Scabies are pretty sturdy, so they can actually multiply and live on inanimate objects, specifically on sheets or on clothes. And they are transmitted by skin-to-skin contact or by coming in contact with a fabric that has been contaminated with the mites. Obviously, you cannot see them, so many times the person infected with the mites doesn't even suspect that they've been infected with the mites, but soon enough, the skin becomes red and itchy. The person can develop red bumps over the affected areas. That is where the mites are. The immune system is trying to target the mites but cannot expel them from the skin. And that can develop in time into almost a body-wide infestation, usually affecting the skin folds more than other areas, but that infestation can actually spread to most areas of the body, usually with the exception of the head and the neck. So those areas can be very, very itchy, very irritated. In certain cases where scabies has been either neglected or mistreated with topical steroids or systemic steroids, thinking we were treating eczema, we can end up with something called Norwegian scabies, which is a much more severe infestation of the skin with the mites, and that can be extremely itchy, like the person losing their minds over the amount of itch that they have to put up with. Now, scabies can be acquired, again, by coming in contact with a person who has scabies on their skin, whether they're showing symptoms or not, and then it can be acquired through contact with contaminated sheets or clothes. The most common scenarios are healthcare facilities such as hospitals or nursing homes, rehab facilities, and in some cases, hotel or motel rooms, where the sheets have not been changed by the hotel staff between occupants of the room. So that can be a source of transmission for you. So if you've gone into a healthcare facility and have come out itchy, chances are you have scabies. If you've gone on vacation, spent some time in some cabin in the woods, and come back with an itchy rash, you may very likely contracted scabies from the bed sheets. So what can be done about scabies? Well, scabies can be treated either by topical medications or systemic medications, depending on the severity of the disease and other considerations. But scabies is a treatable and incurable condition. And in most cases, you just have to make sure that you get the right treatment. You launder your sheets and your clothes and everybody else in the household. If you spend significant amounts of time in close contact with other people in your household, that could be a source of recontamination, reinfestation. So you need to make sure that everybody at home gets treated and the infection cycle is broken. Pubic lice are another disgusting parasite that can infect the skin. Pubic lice are considered a sexually transmitted disease. They are especially equipped, as you can see in this photo, with hooks that allow them to hang on to hairs, and they can latch onto hairs very easily. They usually cause itch over where they infest the skin, and they affect the areas that are hairy over the skin. They can affect the pubic hair, but they can also latch onto other areas of the skin with hair, such as the skin folds, the eyelashes in certain cases, and even the scalp. Pubic lice need to be treated. Obviously, you need to launder your sheets and your clothes because they can latch onto and live on fabric for a few days at a time. And obviously, if you are in close contact with anybody, let alone somebody who has pubic lice, both of you or all of you need to be treated to break the infection cycle. These are especially nasty. They are easily recognizable, and they're actually visible to the naked eye. So you may see things crawling on your skin. If you're seeing that, chances are you have some form of lice. And pubic lice are usually sexually transmitted, meaning transmitted through sex contact, but they can definitely be transmitted through body contact that is not necessarily sexual, as long as the body parts bearing the louse are coming in contact with each other. Pubic lice, just like scabies, can be treated with anti-parasitic medications and are a curable disease. All you need to do is go see your dermatologist, Be treated, get rid of the infection, and you're done. Last on the list is cutaneous larva migrans, or skin infection or infestation with hookworms. Hookworms are a very diverse group of parasitic worms that cycle through the bodies of different animals. In the case of cutaneous larva migrans, these are usually hookworms that infest cats or dogs. These worms are excreted in the feces or the bowel movements of the animal and are spread through the soil and are usually infecting unsuspecting humans by the skin touching the infected soil. These parasites can actually latch onto the skin but cannot penetrate the skin more deeply as they don't have the enzyme known as collagenase, which would have enabled the parasite to migrate deeper into the body. This infection usually occurs in warmer climates, meaning the Southeast United States, South America, Southeast Asia, and Africa. The condition itself looks like serpiginous red areas, meaning worm-looking like areas on the skin that are particularly itchy, and these extend at a rate of about 1 to 2 centimeters a day, meaning the worm is trying to migrate through the skin, but it's doing it pretty slowly. That is as opposed to a condition called cutaneous larva occurrence, which is caused by a worm called strongyloides. And that condition can actually be characterized by very rapid movement, meaning centimeters an hour. These are much faster worms, but again, the condition is restricted to the skin. Cutaneous larva migrans is usually a self-limiting condition, but we tend to treat them. First of all, it is disgusting to have worms inside your skin. Most people don't like that and they demand to be treated. So the medications that are usually administered are anti-worm medications. There is a risk of cutaneous larva migrans becoming infected secondarily with bacteria as the skin is broken and compromised, and that's another reason to treat besides the vomit factor. If you've enjoyed this video, share, like, and subscribe. Put a comment in the comment section and tell me, have you ever suffered from a parasitic infection? How did you diagnose it, and what did you use to treat it? Also, don't forget to hit the notification bell for notifications of future episodes. More great content coming your way right from this channel. Thanks for watching, and God bless.